The European Union is seeking to equip health practitioners with the resources and knowledge to prevent an epidemic of non-communicable diseases in sub-Saharan Africa. The project also intends to reduce the disease burden on the already ailing economy of countries in the sub-region and ensure a healthy citizenry. Fred Kwame brings us a detailed report from a consortium meeting of the Train the Trainer workshop held at the University of Health and Allied Sciences.
Sub-Saharan Africa has been identified with increasing cases of non-communicable diseases and child health issues. This development is largely attributed to lifestyle among other factors and identified to burden the health sector in the region. It was in this vein that the European Union initiated the capacity strengthening of transdisciplinary education for non-communicable diseases in West Africa project. As part of the project, 6 courses would be developed and embedded into the curriculum of the University of Health and Allied Sciences, University of Ghana, Kwame Nkrumah University of Science and Technology, and the University of the Gambia. Dr. Kirsten Clipston-Grubish, who is the Vice Chair of the Global Health Center for Health Sciences and Primary Care, is the facilitator of the project.
An important part of that is, of course, also to look at financing, at health financing, and that's also then part of the courses. And as we are having so many intervention programs that are already taking place or that are planned, it's very important to also contextualize and to look at how can we make sure they are really reaching everybody and they are also then achieving that disease is much better controlled. And as part of that, we are all very interested, of course, also using modern technology. So an important aspect and also of those courses is to specifically look at how can we use modern technology.
Professor Paul Anuma of the University of Health and Allied Sciences shed light on the short and long-term goals of the project.
And the first and the most important is to build capacity. And so we target to train 50 teachers at higher education level as a first step. And these teachers would then also train others. Not only that, we are also introducing an innovative teaching and learning strategy. That is what we call the challenge-based learning. Thirdly, ultimately, the plan of our universities is to harmonize the way that we train people. And then ultimately, we're going to embed these short courses into our existing Master of Public Health programs across our universities.
Because NCD, only one healthcare professional or one discipline cannot take care of that. It must be the nurses, the doctors, the public health officers, the physiotherapists, and other cadres of within the healthcare workforce, right? And then we're also collaborating with Ghana simply because we believe that we are having the same problems, having the same issues. So coming together, collaborating together, and then working towards the capacity building for NCD in these 2 countries is very important.
Fred Kwame Joy News.